an RN at Fort Walton Beach Medical Center, and I'm going to talk a little bit about broken heart syndrome, the bits that I know. It is, in fact, a real diagnosis, and I think it's called Takotsubo. And basically what it is a stress-induced cardiomyopathy where your body emits some stress hormones, and it can actually affect your heart muscle and affect how your blood is pumping through your body. One of the ways to tell if you are either experiencing a heart attack versus something that is related to this stress-induced myopathy is you should go to the ER if you're experiencing any chest pain, shortness of breath, any pain in your shoulders, jaw, and they'll be able to run some tests that will help distinguish whether or not this is something called broken heart syndrome or an actual myocardial infarction, which is in fact a heart attack. One of the labs that they can draw is called a troponin level, and that's an enzyme that your heart will secrete if it's lacking oxygen. So if that's positive, then you are in fact probably having a heart attack. And for the broken heart syndrome, I think something that would be a little more accurate to diagnose that would be an echocardiogram, because that would kind of diagnose the chambers in your heart and see the muscles and blood flow and seeing how. Yeah.
Okay.
And one thing, yeah, usually you experience kind of like a anxiety or panic, but you know, you could talk to your doctor. Also fatigue is another one that people experience, and a lack of wanting to get up and do activities. So you can talk to your primary doctor, and it could be a slow, sudden thing that kind of comes on, but it's usually after a death of a loved one, most common. But you have heard of husband and wife have been together for 55 years, and then the wife or the husband passes away, and the other one passes away shortly after, just due to that stress, and they were perfectly healthy prior. But I just wanted to enforce that is actually a real disease. It's not just a saying, it's actually a real happening, and we do get people in the hospital that have that. So there are actually some long-term effects that can, with this stress, it can damage the heart muscle, but it's treatable. It can help. I'm trying to think. Long-term effects would be heart disease, yes, heart failure. The heart muscle gets worn out, so blood and fluid doesn't get pumped properly in your body and builds up. And, yes, this is a real condition, in fact.